Scenario: a 70-year-old woman admitted with abdominal pain, initially diagnosed as acute diverticulitis, responded well to analgesia and antibiotics. She developed acute limb ischemia, PR irregular, right lower limb, pale, pulseless, hyperkalemia noted, ABG reveals metabolic acidosis. Arterial duplex imaging confirms acute ischemia, ECG shows atrial fibrillation, AF, task. Call the vascular consultant to provide an update on the patient and request acceptance of the referral. Hello, I'm Dr. Aisha, CT1 General Surgery. I'm calling to speak with Mr. Ali, the vascular consultant, to request acceptance of a patient referral with critical limb ischemia. Could I confirm that I am speaking to Mr. Ali? Yes, summarize your case. A 70-year-old woman with mild diverticulitis showed improvement with some antibiotics and intravenous fluids, but suddenly developed severe pain, paleness, and loss of pulse in her right lower limb. Tests revealed metabolic acidosis, low potassium, AF on ECG, and arterial duplex confirmed acute right leg ischemia. I recommend transferring her to your care for definitive treatment. Is it urgent, or can we send it tomorrow morning instead? Yes, it's urgent. The patient has acute limb ischemia, and early intervention is crucial to prevent limb loss. Why do you suspect acute limb ischemia? Clinical signs: pallor, pulseless, pain, ECG showing AF, a risk factor for emboli, and arterial duplex imaging. What are the 6 PAS? Pallor, pulselessness, pain, poikilothermia, paresthesia, paralysis. What does poikilothermia mean? Coldness. Do you need a cardiologist to review premature ventricular complexes, PVC, before transfer? No, that can be assessed later. What's the suspected cause of arrhythmia? Likely electrolyte disturbance, such as hypokalemia. What do you think of her resumed diagnosis of diverticulitis? Given acute limb ischemia and AF, we must consider mesenteric ischemia as a cause of her abdominal pain. What are your differentials? Mesenteric ischemia, perforated viscous infective colitis. Do you want to scan the abdomen first? We'll need to scan her abdomen, but I think it's best after the transfer. Could it be mesenteric ischemia? Yes, it's a possibility, but currently the abdomen is soft and not tender. I'll perform serial abdominal examinations and consider a CT scan if necessary, butting renal function in consideration. What imaging to do? Arterial duplex and CT angiogram for surgical planning. What will you do if the patient has contrast allergy? Magnetic resonance. Angiogram, MRA. How to transfer, type of ambulance? Arrange for urgent transfer by blue light ambulance. What will you prepare in the ambulance? I will prepare CPR set and syringe pump for cardioversion drugs, amiodarone. What is your management plan? 1. Initially follow CRISP guidelines. 2. Correct hyperkalemia. Administer IV KCl 20-40 mmol in 1L, normal saline. Monitor closely with continuous ECG and serial K-level measurements. 3. Correct AF. First, address the underlying cause, hyperkalemia. Consider rate control, beta blockers, and rhythm control, amiodarone. 3. Correct AF. First, address the underlying cause, hyperkalemia. Consider rate control, beta blockers, and rhythm control, amiodarone. 4. Anticoagulation. Administer a bolus of UFH 5000 IU intravenously or LMWH 40 ml days subcutaneously. How would you inform the family about the patient's condition and the need for urgent intervention? I will explain that the patient experienced a sudden decrease in circulation in her lower limb, requiring urgent intervention. That's why we are transferring her to a vascular team. What is the early sign of ischemia? Pain out of proportion due to nerve ischemia. What a positive 2 points discrimination test indicates. If positive, it indicates the limb is viable. Thank you for your time, Mr. IE. Thanks. Goodbye.